Hello and welcome to our presentation on the Illinois Occupational Therapy Supervision and Delegation to Assistants and Aides. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on private payers. Members can also simply email us at any time with any compliance or billing questions or arrange a phone call. We also offer more comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. To maintain high standards of practice based on professional principles, supervision shall connote the physical presence of the supervisors and the OTA at regularly scheduled supervision sessions. Supervision shall be provided in varying patterns as determined by the demands of the areas of patient service and competency of the individual OTA. Such supervision shall be structured according to the OTA's qualifications, position, level of preparation, depth of experience, and the environment within which he or she functions. Supervisors shall be responsible for the standard of work performed by the OTA and shall have knowledge of the patient and the problems being discussed. Co-signature alone does not reflect supervision. OTAs with less than 1 year of experience. The OTA who has less than 1 year of work experience or is entering new practice environments or developing new skills shall receive a minimum of 5% on-site face-to-face supervision from a registered OT per month. The on-site supervision consists of direct face-to-face collaboration in which the supervisor must be on the premises. The remaining work hours shall be supervised by a combination of telephone, electronic communication, telecommunication, technology, or face-to-face consultations. An OTA with more than 1 year of experience in his or her current practice shall have a minimum of 5% direct supervision from a registered OT per month. The 5% direct supervision shall consist of 2% direct face-to-face collaboration. The remaining 3% supervision shall be a combination of telephone, electronic communication, telecommunication technology, or face-to-face consultation. It is the responsibility of the OTA to maintain on the file at the job site signed documentation reflecting supervision activities. This supervision documentation shall contain the following: the date of supervision, means of communication, information discussed, and the outcomes of the interaction. Both the supervising OT and the OTA must sign each entry. Any person who is issued a license as an occupational therapy assistant may use the words occupational therapy assistant, licensed occupational therapy assistant, or he or she may use the letters OTA, OTAL, COTAL in connection with his or her name or place of business to denote his or her licensure. As of now, Medicare requires that therapists in private practice or employed by a physician group be on site when an assistant is treating a patient. The 2025 proposed physician fee schedule will change that rule to general supervision so that therapists can be off-site when assistants are treating patients, though therapists will need to be available by phone. For states with more restrictive supervision levels, such as direct supervision, those therapy services are always furnished to the extent that is permitted under state law. And if it's required that you be on site by state law, you will still need to be on site when treating a Medicare patient. Most payers and state Medicaid programs defer to the state's physical or occupational therapy board rules for the supervision of assistants, but may require more frequent reassessments. TRICARE follows the Medicare rules and requires on-site supervision and have yet to propose a change to that rule. An aide in occupational therapy may be called an occupational therapy technician or an occupational therapy paraprofessional. This is a person who is not licensed and provides supportive services to OTs and OTAs that may include client-related and non-client-related duties and that do not require the knowledge, skills, or judgment of an OT or an OTA. Under general supervision, an aide may do routine department maintenance work, transport of individuals, patients, or clients, preparation or setting up of treatment equipment and work areas, taking care of the individual's or client's personal needs during treatment that are not part of the occupational therapy treatment, clerical, secretarial, and administrative activities, and assisting in the construction of adaptive equipment. On-site supervision is required, and that means within the field of vision of the OT or OTA, when the aide is performing following up with selected routine activity or exercise, and aiding the OT and/or OTA during occupational therapy treatment of the individual, patient, or client. Duties that aides in occupational therapy shall not perform include, but are not limited to, initiation and/or interpret referrals for occupational therapy services, perform evaluative or assessment procedures, develop, plan, or adjust or modify treatment procedures, act on behalf of the OT or OTA in any manner related to direct individual patient-client care that requires judgment or decision-making, document services reported as occupational therapy, or represent him or herself as an OT or OTA. An aide in an occupational therapy may not provide direct treatment to a client or patient. An aide in occupational therapy works under direct on-site supervision of an OT or an OTA who is ultimately responsible for the use of aides in occupational therapy. Any duties assigned to an aide in occupational therapy must be determined and appropriately supervised by an OT and/or OTA and must not exceed the level of training, knowledge, skill, and competence of the individual being supervised. Medicare, TRICARE, and most Medicaid programs expressly state not to bill for the services of aides. Most private payers state that services must be performed by a licensed therapist or an assistant under their supervision. Do not bill for services provided by aides unless the payer guide expressly allows you to. I've never seen a payer allow billing for aide services and really would recommend never doing it. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.